So today let us try to study diabetes. So this is the cell wall, and here you have glucose in the blood. It can go inside and it can come outside, but it cannot do so when at its sixth bond you attach a phosphate. Then it will go through the Krebs cycle. It will become pyruvic acid, which will participate in the Krebs cycle, and one of the important conversions in the Krebs cycle will be acetic acid. So this binding of phosphate is brought about by an enzyme called as hexokinase, and that is stimulated by a receptor here which is called as the insulin receptor. So what basically happens in diabetes is that normally this insulin receptor would go inside the cell, stimulate hexokinase, and after the work of the hexokinase is done, it will come back and stick to this cell membrane here. Now, when there is too much of fat, it messengers to this receptor. So obesity and fat. So there is a message to this receptor to go in, but not come out. Therefore, the system of glucose 6-phosphate staying inside the cell fails, and blood glucose levels start increasing. This glucose is secreted in urine, causing glycosuria. But much more important, this Krebs cycle based on the pyruvic acid and consumption of glucose fails. And therefore, instead of glucose, you need this acetoacetic acid. Now this acetoacetic acid is a product of fatty acids or triglycerides being converted into acetoacetic acid, 11 hydroxy butyric acid, and acetone. If the acetone is excess, you can find it in urine. These fatty acids would come from the liver, and therefore you may have a fatty liver. And this liver will get fatty acids from fat, and these fat will pass through the liver through blood vessels. And when lot of fat passes through the liver to the liver through blood vessels, this causes atherosclerosis. And the four effects of atherosclerosis are renal, retinal, cardiac, cerebral. So you may have renal failure, you may have diabetic retinopathy, blindness, you may have cardiac problems, ischemic heart disease, and you may have stroke. But besides this, you also have neuropathy, and small blood vessels get obliterated, which is called as microangiopathy, and this can lead to the diabetic gangrene. So this is the mechanism of obesity or diabetes mellitus. And the central mechanism for diabetes mellitus is lack of these receptors, insulin receptors on the cell. And this is called as insulin resistance. So if in diabetes mellitus you have normal or higher levels of insulin and still this mechanism is operating, you must understand that insulin receptors have been taken off the cell walls, especially the muscles. So how to bring these receptors back onto the muscle cell wall? The answer is exercise. And this exercise has no incremental effects after you do a half hour of walking per day. Half hour of walking, if you do it 1 hour, if you do it 2 hours, it doesn't make a big difference. But from 0 to half an hour of walking makes a lot of difference, and these insulin receptors are restored. And if you do a weight loss, then also this mechanism is reversed. So diabetes is not your enemy, and it should be controlled by weight loss, eating less carbs, basing your diet on protein and fat, which is called as keto diet. And observe your weight, let it go down. There are apps which would tell you how much calories have you taken for weight loss. And one of them is that I use is myfitnesspal.com. When this doesn't help, then you talk of metformin, which deals with the energy crisis in the cell by acting on mitochondria. There are other oral anti-diabetic drugs, and finally you may have to take insulin. So this in short is the talk on diabetes mellitus.